Hello, precious mamas and mamas-to-be. This is your host, Ilka B, with the Liberated Birth movement.
Another myth. More prenatal care leads to better outcomes.
Unfortunately, that is not true, and we're going to get into that in just a minute. But what does mean prenatal care? Well, prenatal care means that most women, most healthy women in America see a doctor for their prenatal appointments, and they see him about once a month for 15 to 20 minutes. What are they doing there? Well, they're measuring your blood pressure. They get you on a scale to measure your weight. There's a bunch of ultrasounds all through the different stages of pregnancy. There's genetic testing, there's scans and measuring, there's vaccines and all kinds of other things. So what does that mean? It means that every single woman, if she's healthy or if she's high risk, has to go through the same routine procedures. And that means your prenatal care is actually pretty medicalized and pretty routinized. And it leads us to actually not truly take care of ourselves. So the problem with that is that two things. We lose touch with ourselves and we give power away to some outside source that we trust knows better what's going on with ourselves. So how's a better way to do that? Well, you can either have your prenatal care with a midwife who's definitely going to take more individualized, more personalized care for you. She will take probably an hour of time once a month and ask you some powerful questions about your relationship and how your connection is with your baby and how you're exercising and how your nutrition intake is, because all these things are actually really, really important. It is not about, prenatal care is not about just 15 minutes once a month having routine measurements done, but it is about 24/7 truly taking care of yourself. And that means developing things to deal with your fear, tools like breathing or yoga or affirmations. That means really knowing what you take in, because you actually built this baby from whatever you're eating. So you need to know, do you have all your glycine? Do you have all your protein? Do you have all, the water that you need to build enough amniotic fluid? Do you have all the things that you need to have good energy and for the baby's perfect development? And you also need to do things like, exercise and walk to have a good positioning of your baby. You need to make sure that you are dealing with all the things that are coming up when you tell your friends about your birth choices. Negative people, negative stories that come onto you. How can you shield yourself and stay positive and stay strong and trust in your body? So these are all things that we actually need to care for, and you do not necessarily need to see a doctor to get optimal prenatal care.
Please follow the Liberated Birth movement on Facebook or subscribe to our channel. If you have more questions how to apply these ideas to your pregnancy and birth, schedule a call and we'll get you clear on what you want and how to get it. Meetme.so/liberatedbirth. Meetme.so/liberatedbirth. Always remember, birth belongs to women.